Welcome to Promoting Research Representation and Engagement, Opportunities Under the Common Rule. My name is Marianna Azar, and I am a program specialist with the Office for Human Research Protection's Division of Education and Development. A quick disclaimer before we jump into the presentation. Any opinions I may express are mine and do not necessarily reflect the policy of HHS or OHRP. There are some regulatory references made in this presentation. For a complete and accurate description of the regulatory requirements, please visit OHRP's website and refer to the text of the revised Common Rule. Our learning objectives for today. In this presentation, I aim to briefly explain the historical events that led to the development and publication of the Belmont Report in 1979. Detail the way the principle of justice was articulated in the Belmont Report, offer an overview of historical events that have affected our interpretation of the Belmont principle of justice, and then explore relevant provisions in the Common Rule that we can lean on to promote representation and engagement in research. So, the historical origins. Well, in the 19th and 20th centuries, we can point to several research experiments in which the poor, marginalized, and vulnerable were used by researchers for experimentation that posed significant burden on subjects with little or no benefit. Among the most notorious are, of course, the Tuskegee syphilis study, the Nazi concentration camp experiments on prisoners, the hepatitis studies on mentally disabled children at the Willowbrook State School, and many others. The through line in these cases is that individuals and populations, namely those in positions that made them vulnerable to exploitation, were singled out to bear the burdens of research for the benefit of others or for the benefit of scientific knowledge. As the public began to learn of these exploitations, there was understandable and notable outrage, eventually prompting the creation of the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research, or as we commonly refer to it now, the Commission, and the publication of the Belmont Report in 1976. The concept of justice that many of us are familiar with today was introduced in the Belmont Report as a guiding ethical principle for conducting research involving human beings. In the report, justice refers to fairness in distribution, or stated otherwise, a balance in the risks of possible harms. Oh, sorry about that. The risks of possible harms incurred in the research against the benefits expected to result from it. So to flesh this out a bit further, the report asserted that there should be fairness in the research procedures, the research outcomes, and in the selection of research subjects at both the individual and the societal levels. It also put forth the notion that research that holds out the prospect of a special benefit should not be reserved for only favored individuals, nor should risky research enroll only undesirable persons. Social, racial, gender, or cultural biases should not, the report stated, be allowed to unbalance the fair distribution of burdens and potential benefits of research. To put it crudely, the report called for a focus on the selection of research subjects as a way to advance distributive justice in research. It also put forth the notion that historical practices involving the selection of disadvantaged populations for research on the basis of their comparative availability and low social standing, especially when these populations ran the risk of harm and more advantaged populations reaped the eventual benefits of the research, required that certain groups of vulnerable populations, specifically the report names pregnant women, children, and prisoners, receive additional protections, and that the researchers offer additional justification for the inclusion of these groups in research. Okay, so the Belmont Report serves as the ethical backbone of U.S. federal regulations governing human subjects research. Now, since Belmont frames justice in terms of protection, We ended up with both an ethical and a regulatory framework that carried certain assumptions about research risks and required protections for research participants from those risks. So, if we think of research as potentially being exploitive of certain individuals or groups, we are then pushed to be cognizant of the need to select subjects for research participation who are not already bearing other societal burdens. And in considering vulnerable populations, again, namely children, prisoners, pregnant women, but more more broadly, individuals with various disabilities or the economically or educationally disadvantaged, we are asked to consider the danger of their involvement in research solely for administrative convenience or because they are easy to manipulate as a result of their situation. So, when we take that framing, we are required to impose additional protections for these groups and to seek additional justification for their involvement in research. So, where does this framing of justice as protection lead us, and what problems does it create? Well, one of the most notable challenges to the way that we think about and apply the principle of justice to equitable selection of subjects came in the 1980s and 90s. The early research on the treatment of AIDS in people infected with HIV was the catalyst for this shift. At the time, AIDS was having a significant impact on the health of the gay community in the United States. And yet, according to the traditional interpretation of the principle of justice, researchers should have been cautious about actively recruiting prospective research participants from the gay community for clinical trials because, after all, gay people were a vulnerable population that was frequently discriminated against. So, from this viewpoint, the gay population would have been unfairly exploited if they were to be predominantly recruited into the early HIV/AIDS clinical trials because they would bear a large portion of the research related risks, while the eventual benefits of the research findings could lead to effective treatment for people with AIDS who were more socially advantaged and not necessarily marginalized or discriminated against. For example, those who had acquired HIV through blood transfusions or other avenues that society did not scandalize. But the gay community actively advocated for a different posture towards the research. They pressed to be included in a significant portion of the treatment studies and promoted the view that the research findings would have a greater likelihood of benefiting their community if they were included in those initial studies. Exclusion, they argued, posed the risk that the findings of the research may not be applicable to the gay population. And so, in some ways, the principle of justice is turned on its head. Instead of protecting an otherwise vulnerable population from exploitation, the dominant concern became one of avoiding exclusion from research participation and mitigating the possibility that a population in need of treatment would not stand to benefit from the findings of the treatment studies. Now, in the middle of this slide, you'll see a link to a keynote address that Dr. Anthony Fauci gave in 2014 on the very difficult choices faced in the early years of the HIV/AIDS epidemic, including the connection between that historical battle and more contemporary challenges, such as the equitable selection of subjects for the Ebola vaccine studies and related. This video, among many other lectures by esteemed individuals with incredibly thought provoking insights on human subjects research protections, is available on the OHRP. I'm sorry, it just keeps clicking forward on the OHRP's Luminaries lecture page series. So, if this topic is of interest to you, I very much encourage you to follow the link that you see on the slide in front of you. Okay, now the concern of being excluded from research participation soon did spread to other groups, including other groups of vulnerable populations, such as pregnant women, children, and individuals of various ethnic and racial backgrounds. Representatives of these groups began to advocate for the inclusion of their populations in relevant research studies in the view that leaving them out could mean failure to get their fair share of benefits that the research could potentially pose. So, This perspective became embodied in such policies as the 1993 NIH requirement regarding the inclusion of women, minorities, and children in research studies where appropriate. Public attention also shifted to prominent issues that underscored investigator failure to consider inclusion and representation in study design, which resulted in study findings that were not sufficiently generalizable because the participant groups were not reflective of the general population. One example of this is the drug Plavix, which is prescribed to prevent strokes and heart attacks. But unfortunately, as a blood thinner, Plavix needs to be activated by the body's own enzymes, which, after the drug came to market, it was determined that and prescribed to the broader population, it was determined that can have genetic variety. So subsequent studies have shown that about 14% of Asian patients are unable to metabolize the drug properly, compared with just 4% of Black and 2% of white patients. In 2010, the US Food and Drug Administration issued a new warning label for Plavix to reflect this information. More recently, and again, I'm so sorry, it just keeps clicking forward. More recently, we've also seen the impact that exclusion of certain groups from clinical trials, such as the exclusion of pregnant women from the first wave of COVID-19 vaccine studies, has on public health and efforts to address public health emergencies, such as the COVID-19 pandemic. Now, another major shift in the way that we think about and apply the principle of justice and research related harms stems from the growing attention to the concept of group harm and the question of whether research studies should not lead to harms to identified groups because of participation of their individual members. A series of studies using biological samples from members of the Arizona Havasupai tribe motivated some of these discussions and considerations. So the Havasupai had agreed to provide samples to enable a research study addressing the rates of diabetes among their tribe members. But they later learned that additional secondary studies were being proposed to examine questions related to mental disease prevalence among their group, as well as a study of geographic ancestry. The Havasupai objected to these secondary studies because the study on mental disease was, of course, potentially stigmatizing, and the study on geographic ancestry potentially in conflict with their traditionally held beliefs regarding their geographic lineage. Now, cases like this one prompted the argument that the Belmont report focus on the protection of individuals rather than groups was too limiting, and that the principle of justice specifically ought be modified to also consider group harms. So, in this respect, the principle of justice would be expanded to encompass social justice, insofar as our focus would be on whether society shows the proper respect for the rights and interests of particular groups, especially those groups who have been historically victims of some form of discrimination. So, if you're interested in this topic, I encourage you to check out a recording of last year's. And again, I'm so sorry, I have no idea why, but it's just automatically advancing. Last year's OHRP exploratory workshop on third party research risks, as well as the 2022 SACRA recommendation on the protection of non subjects from research harm. And links to all of these resources that I'm referencing throughout this presentation are included in the final slides of this presentation. All right. Now, some groups have also used the principle of justice to motivate researchers to address inequities in society through research aimed at finding ways to ameliorate those inequities. Now, we can see this in the increasing role of research participants and communities and the role that they play in the selection and design of research studies, as well as the growing popularity of community-based participatory action research, citizen science, and initiatives such as the Patient-Centered Outcomes Research Institute. Now, with these efforts, justice is reconstrued to reflect the democratic principles of the public having more of a direct say in what research society is willing to support, rather than simply leaving those questions to the peer-reviewed decisions of expert scientists or, those in positions of power within academic and research institutions. Now, this often translates into the focus of just research or justice-oriented research. Now, another shift in our view of justice relates to the ways research studies have been integrated into the healthcare system that provide clinical care. Seeing a direct impact of research has led some to argue that the public has an ethical obligation to participate in research. After all, people who make use of the healthcare system of today are benefiting from improvements in the delivery of healthcare that has been generated, at least in part, by the participation of others in research in the past. So, justice is therefore expanded to include the norm of reciprocity or of giving back in response to having been given a benefit. Now, on this theory, people are motivated to participate in research in appreciation of what they have been given through the participation of others in past studies. And so from the 1980s to today, we see a shift in the way that we think about and apply the principle of justice to human subjects research. We see a recognition of the potential benefits offered by research and a corresponding demand from the populace to be included in research to potentially derive said benefits from research participation. We also see a shift in focus. Rather than protecting the vulnerable by excluding them from research, we now see equitable selection to mean inclusion. In essence, we shift our focus to the importance of fair distribution of research benefits, rather than narrowly focusing on avoiding uneven distribution of research burdens. We also see more scrutiny applied to exclusion based on the principle of justice as protection. There is now a better understanding that prior guidance around the selection of research participants has led to unnecessary exclusion of some individuals or groups. So, what we are left with is a principle of justice that calls on us to promote representation and engagement in research, and to think about and define justice in broader and more nuanced ways than previously formulated. Okay, so now let's take a look at the common rule and see if there are regulatory provisions that we can lean on to help further the idea of promoting representation and engagement in research. Now, if justice means access, the old idea that participating in research is a burden and that participation may sometimes be exploited requires a reorientation to a more proactive and positive take on research participation. But what does this actually mean? Well, this means that we must make an effort to raise the opportunities of the vulnerable, marginalized, or underserved to access research that matters to them, and to ensure that research studies are safe and inclusive and their results generalizable so that groups inclusive of the vulnerable, marginalized, or underserved also reap the benefits of research. Of course, we cannot overlook or erase the history of exploitive or unethical research or the subsequent persisting distrust. So, part of the effort to promote justice as access to research might also involve reaching out to individuals of traditionally underserved or exploited groups and their communities with the goal of building trusting relationships. So, what about IRBs and investigators? What can they do about this? Well, if we start by looking at the IRB review criterion for equitable selection of subjects, what can we see there? Well, until recently, IRB reviewers and investigators may not have paid too much attention to the criterion of equitable selection of subjects. Many would simply assume that the subject populations that investigators have included in their research protocol were appropriate. And when investigators mentioned any exclusions, unless they were obviously unreasonable or egregious, very few reviewers IRBs would question the justification for excluding certain groups of people or people. However, this review criterion specifically requires IRBs to consider the purpose and the setting of research when deciding if subject selection is equitable. So the idea here is that the principle of justice plays itself out at the time of recruitment. And through an equitable selection of subjects, the research is assumed to have a fair distribution of the burdens and benefits of research. So, who you approach for recruitment and where and how you approach them may be a significant factor for IRBs to consider. Reviewers and investigators should also clearly understand what the burdens of research participation are and on whom those burdens would fall. Likewise, they should understand what the anticipated benefits may be and for whom. Note that burdens are not just the risks of the research to individual participants. Other burdens may arise as a result of the setting and the situation of the prospective research participants, and this also deserves appropriate consideration. Burdens could include time taken away from work, expenses to pay for childcare to attend a study visit, as well as other opportunity costs. And benefits are not just the potential benefits that individual participants may derive from, for example, their participation in a therapeutic clinical trial. More broadly, benefits may include the opportunities participants and their communities and groups they identify with might reap from the research. So, this can include the generalizability of the research findings, new treatments and interventions that result, but also more immediate benefits, such as the resources and infrastructure that the research may bring to the community or group. This can be through something like opening a health clinic, providing health screenings as part of the research procedures, allowing access to medical and other personnel, gifting tablets to a school that are initially used to conduct research but subsequently gifted to the school for standard educational purposes. So, how do we promote an equitable selection of subjects? Well, we can start by asking very specific questions when research is designed, reviewed, and so forth. And we can start by asking who investigators are proposing to include in the research. What are the specific reasons for selecting or including these individuals as opposed to another group? Is this selected subject population appropriate for answering the particular research questions that the investigator aims to address? We can also ask if the proposed inclusion is simply a matter of convenience for the researchers. In other words, that the investigators happen to have access to this population, or the population happens to be around, is easy to reach, or they're unlikely to say no. It goes without saying that investigators should avoid exploiting or taking advantage of people or groups, but shining a light on the use of specific groups or populations on the basis of convenience or availability is also important for IRBs to do. When we frame things in terms of burdens, we can also say that investigators slash researchers should not burden those who have little or no chance of benefiting from the research by inviting them to participate. To put a positive framing on this, we can ask if the inclusion criteria is the result of thoughtful consideration, such as this is the population that has a high load of this condition that I am studying. And so, if not the immediate subjects, then at least their communities might stand to benefit in the long run from the research that I am proposing to conduct. So, when you think about benefits, again, I'm so sorry. Um, so when you think about benefits, if no direct benefits are to be considered, then you can at least focus on what the indirect benefits might be and consider these when considering your selection of subjects. Now, we should also actively ask why investigators are excluding certain people. So, what are the justifications for the exclusion? Are the reasons for exclusion specific and compelling, or are they just general and vague? Is the exclusion just a matter of expedience or convenience for the researchers? Unnecessarily precluding certain individuals, for example, non English speakers or those with caregiver responsibilities that preclude them from daytime study visits, from participation, limits the generalizability and applicability of the study. In the long run, this could further disenfranchise certain communities and contribute to the erosion of trust as well as perpetuate disengagement in research. To further ensure that the criterion for equitable selection of subjects has a chance to be realized at the time of recruitment, it's advisable that reviewers proactively ask investigators what they are doing to facilitate a broad participant pool. How much do investigators understand about their target communities? Is there a strategy for outreach and recruitment? Is there a genuine and appropriate effort to involve the marginalized and minority groups who may stand to benefit from the research? Are there any needs, concerns, considerations, or other things that are particular to these groups or to the specific community that you are targeting? What are the particular barriers that might significantly affect the participation of those in the targeted communities? And what are the investigators proposing to do to address these barriers? What about the vulnerable individuals who may be involved in the proposed research? Have the investigators included any additional safeguards to protect their rights and welfare? Note that the same extrinsic, circumstantial, or situational factors that may render individuals vulnerable, such as unjust socioeconomic structures, a lack of power, a lack of status, and so forth. These are also often the factors that cause vulnerable individuals to have fewer opportunities and less access to research related benefits. So, in considering how to better protect the rights and welfare of vulnerable individuals, IRBs and investigators could also consider how to revert some of these factors to facilitate access to benefits and to increase opportunities to those who are otherwise vulnerable. Now, IRBs can go even further. They can inquire what investigators are doing to maximize the value for their participants. They can ask, what could investigators bring to the participant communities? What level of community engagement has the investigator sought or plans to undertake? Apart from reaching participants where they are to reduce burdens for them, what efforts are the investigators making to maximize value for participants? For example, are there plans in place to keep participants informed of the progress of the study, to update them on how their participation may be making a difference and how the communities the participants identify with may be able to benefit from the research? So, um, switching gears a little bit. So, respect for persons. Now, respect for persons is also a key component for realizing justice. One might even argue that really respect for persons is where this all starts. Now, this means making sure that individuals feel that they have the information that they need to make their own decision about whether to participate in the research study. This also means that investigators should learn how to communicate effectively and with intention in order to promote trust. The intention here is to empower your prospective participants. And you can do this by paying attention to what information a participant may need and how this information should be presented or communicated so that it can be understood and used to make a meaningful decision about research participation. Too often, researchers see informed consent as a way to give information to shield themselves and their institutions from liabilities or to simply fulfill a regulatory requirement. Except this hardly reflects a respect for your research participants. Your goal should be to learn how to write and design clear and effective consent documents for research participation. This means keeping potential research participants at the center of your thinking when creating documents for informed consent. Our goal should be to give participants clear, understandable information so that they can make a truly informed decision, or to put it otherwise, to approach informed consent in a participant centered way. Sorry, jumped again. So, to summarize this, the participant centered approach demonstrates respect for persons and enhances public trust and engagement in research. Now, the common rule also stipulates requirements for IRB membership that embrace the goal of diversity and inclusivity. So, institutions should recognize the important value that appropriate representation brings to the richness of the ethics review process. The process, the conduct of research involves people, and at the end of the day, the pursuit of science is, after all, for the benefit of people or the pursuit of the common good. IRBs, therefore, benefit from having a membership that appropriately and adequately represents the people who would be impacted by the research. Institutions can do this by paying more attention to the size and makeup of their IRB membership and by putting extra effort into finding a bigger group of unaffiliated non scientists or community members. Community engagement efforts have the advantage of being able to bring in cultural ambassadors whose work could help engage the community and contribute to building a pool of community members. Even for the non scientist members, think about diversity when you have access to people with comparable scientific backgrounds. Now, if you want more information on community engagement and consultation, check out OHRP's Luminary series, which does include several videos on this topic. Fundamentally, research is a connected framework of partnerships and commitments. To ensure public trust in research, to ensure that research continues to thrive, each of us in our different roles needs to chip in and do our part. Now, I want to take a moment to briefly highlight some upcoming OHRP educational events, some of which directly relate to the topic of this presentation. And I want to start with the upcoming fifth annual OHRP Exploratory Workshop, which will explore the question of payment for research participation and the way payment for participation can be used to advance justice, equity, and representation in our research participant pool. This event is free and live streamed globally. A recording will also be made available on the live stream after the live stream on the OHRP website. Visit the website linked on this slide for the complete agenda. And while you're there, check out the video and summary report from last year's workshop, which explored third-party and group research risks, something that I touched on earlier in this presentation. Now, in October, OHRP will also be co-hosting an in-person research community forum with the University of Nevada in Reno. One of the tracks of this event focuses on how we can promote trust, conduct research with respect, and protect populations vulnerable to marginalization through participant-centered informed consent. Visit the OHRP website or the link provided on this slide to see the complete agenda and to register for this event. I also want to highlight some educational resources developed by OHRP so that you can use these to advance justice at your institution. The first is the brochure/poster that you see on the slide before you. Now, this is a tool that we developed to help researchers and institutions communicate with the general public about research participation. So this brochure and poster are written in plain language and include basic information explaining how research works, how it has led to important advancements, and what one should think about and ask about when considering becoming a volunteer in research. This tool is available on our website and can be downloaded and printed free of charge. Lastly, I want to highlight our About Research Participation page and the many resources we have available there. In addition to brochures and posters, we've developed a list of questions to ask, a series of videos explaining research and research participation, and even a series in which we interview past research participants about their experiences. All of the resources on our ARP page are also available in Spanish, including the videos, which include Spanish subtitles. So we strongly encourage you to use these to educate your prospective research participants or members from the community that you are aiming to bring to your IRB. I also want to point you to a few additional resources available on the OHRP website, including some of the things I referenced in this presentation, such as the Luminaries series. You can also review the recently released SACRA recommendations on considerations of the principle of justice and check out the training resources that we developed for those working with IRBs, including the checklist that you see on the slide now. Last but not least, I want to highlight our email address. OHRP is a small office, but we are always happy to engage with the research community and to answer their questions about the common rule regulatory requirements. So the next time that you get conflicting responses from your peers on the IRB forum, just email us at ohrp@hhs.gov. And with that, I thank you for your time and I look forward to your questions.